sink. Limited retention is referring to most orthodontic cases. And the 81 study was followed up quite a few years later, 89, with an article just as sobering, Retainers May Be Forever by Dr. Parker. And as horrible as that sounds, it really isn't. We start off retainers full time, we gradually diminish. I have a schedule I'll show later. So eventually we end with wearing retainers, I recommend, a couple evenings a week. And if patients react poorly to that or parents react poorly, I say, hey, it's like, what's permanent in life? How permanent is hair permanence? It's like saying maybe I'm making it overly simplistic, but I say it's like wearing eyeglasses, maybe 2 8-hour periods a week. It's just not that big a deal. And when they look at it this way, they really don't kick and fuss too much. Permanent or semi-permanent retention, if we have a lot of spacing, mainly with congenitally missing teeth, for example, we want to consolidate the many spaces into few spaces and then retain with bridges and implants. And also possibly other kinds of removable retainers, removable or fixed as well. Requirements of retainers, we want to restrain teeth in the current moved positions, the ideal positions. We want to allow functional forces to act freely. We want them to be hygienic, retainers that is, smooth, polished, no porosities. We want them inconspicuous and strong. We have removable retainers, Hawley type and variations, fixed retainers. Sometimes during retention, we have other appliances being worn, like headgear, which if we have a skeletal discrepancy, we keep that going until end of growth. But as I mentioned again in a previous lecture, headgears aren't used as much today as they were in the past. We have removable retainers, the Hawley acrylic plate with wires and clasps, and the invisible type. The problem with invisible type is that they're thin plastic, and thin plastic can wear out. I've seen these last only a month, maybe it can get longer, usually can get longer, but the point is that these can break rather quickly, and patients have to be aware of that, and if they really like clear retainers, then they have to be remade periodically, and the practice will most likely pass on lab costs to them, which can get rather expensive. Remaking a set of retainers, say, every month or 2 or 3. Versus the Hawley on the left, I can get easily 15 years out of these. Yes, they can be lost or broken, but I've seen them survive 15 years. And here's a young lady wearing a clear retainer on top. You can barely see it, versus the metal on the lower. And again, problem with the thin, invisible type is that they are more prone to break. Retainer with a ponic placed. Different colors are nice. We let our patients pick out colors and decals, different patterns. This is a retainer where we have a bit of crowding, and we've done a sort of diagnostic setup. We've realigned the teeth ideally, and we make a retainer with springs. It's a flexible retainer that will take the slight malocclusion and coerce the teeth to an ideal form. We have fixed retainers. They can be banded from mandibular cuspid to mandibular cuspid, or uppers for that matter. This is an older generation with bands. More likely today, and our residents do these all the time, and practices do them all the time, the invisible. Realize with invisible, The flossing is more difficult, and the patient has to be committed to using floss threaders or getting under that wire and flossing. Relapse may occur fast, so if you absolutely want to be sure about your retention protocol, you can take impressions before fixed appliances are removed. The lab can carve the brackets and bands, fabricate the retainers over that. It's close enough so we can adjust the retainer on delivery by adjusting the loops, and we take off the braces and deliver retainers at the same appointment. I do this if the patient's compliance with appointments is questionable. So if I think a patient is going to disappear for longer than a month, I'll do this. I take impressions over braces and then have the lab do the following procedures. A sample retention schedule is what I use, or by sample I mean not all practices have the same scheme, the same formula. I'll deliver retainers and say, wear them full-time for a month, and I scare patients a little bit. I say, if you don't wear them and the teeth move, then we're talking about braces again. We don't want to do that, right? And that really gets their attention, and they're nodding and say, no, I'll do what you're telling me. So full-time for a month, then I see them in a month, and I say, okay, wear them if they've complied 18 hours a day for 3 months. Then, for example, 12 hours a day, 3 months, 8 hours a day, maybe just nighttime for 3 months. Alternate nights, 3 months, then 2 to 3 nights a week, forever. And again, we don't know if patients follow that forever, but that's what we tell them when we're discharging them in the practice. And we don't close the doors completely, of course. We say, okay, we're done with the braces. Obviously, that was done 2-3 years ago. You're done with your retention appointments seeing me, but wear them 2 to 3 nights a week indefinitely. And if you have a problem with breakage or something seems to be moving, then call the office.